Too often when people think personality disorder, they think one of two things. Either a very difficult, toxic, manipulative person, or they think someone's incapable of change and that's just how they are. I would argue that personality disorders are among the most misunderstood mental health diagnoses. And not just by the public out there, people online, but also by medical providers as well, and tragically so. And that's why I'm so excited to talk about this topic today. Because getting a personality disorder often shapes how people view themselves, how other people treat them, and then in turn how people start to treat themselves. So in today's educational video, I want to walk through what personality disorders actually are, why the name itself is often misleading, and why they aren't these fixed, hopeless conditions, and offer a much more nuanced and comprehensive way of understanding them. But for those of you who are new to the channel, welcome. I'm Dr. Robert. I'm a board-certified psychiatrist. And on this channel, I enjoy making these educational mental health videos. And today we're talking about personality disorders. And of course, as always, these are just educational videos, not medical advice. And if you are experiencing any mental health symptoms, please seek the care of a mental health professional near you. So let's start off with what personality disorders actually are. A personality disorder is intended to describe a long-standing pattern in how someone thinks, feels, reacts to others, and interacts with the world around them. And these patterns need to be somewhat consistent over someone's lifespan, be fairly rigid, and actually cause issues or problems in their life, in their relationships. And here's where most people get tripped up, even some mental health professionals. Because they hear personality disorder and they think, okay, well, this is just how someone is. That's their personality. It's integral to who they are and you can't change it. And that's not an accurate way of thinking about it. In fact, what these diagnoses are trying to describe are ways that people come up with protecting themselves, ways that they've adapted to the world around them, typically early in childhood. And then these coping patterns, these ways of surviving have stuck around. And then later on, they lead to issues in their life. In many ways, these personality disorders, there are these various coping mechanisms that come about early in life in response to stress. They're influenced by early childhood neglect, trauma, emotional invalidation, or early life environments where drastic means were necessary to survive. Of course, with all of this, there is some genetic predisposition and actual natural temperament that plays a role as well. So a more accurate way to think about personality disorders are these coping mechanisms, these behavioral tendencies, rigidities that start to manifest early on in life in response to a stressor, along with some temperament and genetic predisposition together with that. And then they start to form this more structured personality traits that persist later on in life and can cause issues in people's lives. But a pattern of defenses is not the same thing as someone's identity. And I think that's the crucial point. Let's put a greater context as to where these personality disorders, this even idea comes from. I've already made several videos on mental health diagnoses, the imperfections, and the way they come about. I'll put the links down below, so definitely check those out. I think that would give some great context to this video. Definitely mental health diagnoses are not perfect. They don't fully capture the human experience. All that being said, historically, of course, as a profession, psychiatry needed a way to diagnose and consistently describe different patterns of behavior. And so for certain conditions like anxiety, depression, psychosis, we came up with these diagnoses, but these were more periodic episodes of mental health symptoms, right? These weren't these sustained patterns. And so early on, psychiatrists started to devise ways to describe these more ingrained ways that people had of interacting with others and thinking about themselves. And early on, of course, the categorization of this was very sometimes crude, moralistic, and definitely imperfect, even more so than today. But it did allow us at least to create these understood patterns that we see come up in various people. And so all of these different personality disorders came into existence, or at least how they were described. So you had borderline personality disorder, narcissistic personality disorder, schizoid, among many others. I won't go into all of them today. Of course, today's video is not intended as a comprehensive discussion of all the personality disorders. I won't go through all of them. But if you are interested in learning more about each specific personality disorder, I'd love to make a video on each one. Just let me know in the comments. But one of the biggest qualms I have with personality disorders is the name itself. If there's the diagnostic label. Because for many people, right, personality in the modern context is very ingrained with self-value, self-esteem, who we are, how we view ourselves. So telling someone that they have a personality disorder says that who you are is disordered. You fundamentally are disordered. And I think that definitely sends the wrong message. But in reality, as mental health professionals, what we intend to say is early life experiences, other factors, they all created a repertoire of defense mechanisms that are now causing you issues in life. And let's find ways to mitigate them, address them. Having a personality disorder is not a permanent thing. I think that's a shocking fact for many people. They are not permanent. I think a great example of this is borderline personality disorder. One of the more common personality disorders that's more commonly diagnosed, encountered clinically, and that I definitely have a lot of experience treating. And There's a lot of research, my own clinical experience says this as well. Many people who meet criteria for that diagnosis, several years into treatment, no longer do. They no longer have that personality disorder. Because with the right treatment, the right support, people do change. People are able to unlearn some maladaptive coping skills, learn new ones, learn new emotional regulation. I think a great example of that is Marsha Linehan. She's a very famous author, invented DBT, which is the mainstay therapy modality for borderline personality disorder. She herself had a very severe case of borderline personality disorder. And then several years later, very successful person, came up with this treatment modality. By no means does she any longer meet criteria for that. Because all these patterns of interacting, if someone wants to change, they are able to change. And it does kind of get at that old shrink joke of how many psychiatrists does it take to change a light bulb? One, but the light bulb needs to want to change. There is some inherent truth to that with personality disorders. In order for someone to get better, sometimes it can just happen with just their circumstances improving, their defense mechanisms no longer being as activated as they were in the past due to just life getting better. But sometimes it is them needing also to want to work on some of these changes, and then that facilitates the change. And then in the future, them no longer meeting the criteria for that personality disorder. But for anybody with a personality disorder who's in treatment, will tell you it's not a quick process. It's not an easy fix. There are no easy fixes here. But it's an ongoing process of learning new skills, letting go of old habits, and ways of interacting with others, and allowing for more openness and new ways of thinking. There's also a lot of stigma around each specific personality disorder. I think narcissistic personality disorder, people just think that they're obnoxious, overly confident, when in reality, it's a much wider spectrum of experience in narcissism. And I'll definitely make future videos on narcissism, the different forms of it, what that can look like, what treatments look like for it. Because it's a very fascinating condition that can take on many different forms for different people. But we already have these labels, right? These personality disorders. So what are some of the pros and cons of them? Because there are certainly many benefits to having these diagnoses. One is just giving people a sense of explanation, of helping them understand themselves through a diagnosis, of being able to relate to other people with the same experiences. It gives people language for their experience, helps them feel less alone, and helps guide their treatment. Of course, on the flip side, they can also become limiting, right? As we've already talked about, of narrowing people's experience, of reducing them to a diagnosis that often carries way too much stigma around it. And if someone does feel too reduced to a diagnosis, one that carries stigma to it, that can also make them feel more hopeless, more resistant to seek care, especially if they know they may be stigmatized by healthcare professionals. That sort of highlights the idea that diagnosis should be a tool, not a shortcut to assumptions. So here's how I propose we think about personality disorders. Not as these ingrained and movable personality traits that are inherent to who you are, but rather these coping mechanisms that came about early on in life in settings of stress, and that now later in life may not be serving the purpose they once served, or causing some issues. And many people who have personality disorders can definitely attest to it being very distressing. They don't want to be experiencing this. And as with any other mental health condition, there are very reliable, helpful treatments for it. None of them are instant, none of them resolve everything, but they do offer hope. They offer a pathway to improve relationships, improve one's self-esteem and way of thinking about things. And of course, this doesn't excuse the problematic behavior that sometimes comes about as a consequence of personality disorders, but it does offer a way of understanding. So I hope this discussion gives a new framework for looking at personality disorders, what they are, how they come about. And thank you so much for sticking around to the end, for giving me your attention. I really, really appreciate it. It's still a new YouTube channel, so please like and subscribe. It really helps out. And thank you so much, and I'll see you next week.